This little body is covered with sores. His sister also has marks all over her.
We are struggling with hygiene. We don't have cleaning products like shampoo, soap, or sponges. We are living in tents, in sand, with the insects.
Overcrowded tent camps and temporary shelters with no running water, toilets, or sanitation are a breeding ground for the rapid spread of disease. Sewage systems, desalination plants, and water supply networks have all been destroyed by Israeli attacks or have no fuel to function. Famine has been declared throughout Gaza. Children are particularly vulnerable. Their compromised immune systems can't fight the barrage of germs they're up against.
Spots are appearing on my other son. It's an infection. We're sleeping in the dirt with nowhere to go. It's very tough. Please help us. Please supply us with shampoo, even a bar of soap to wash our children's hands.
Hygiene is a luxury. There isn't enough water to drink, let alone wash. Dr. Ahmed Al-Farah heads up the pediatric department of Nasser Hospital in Khan Yunis, where the waiting room is packed with people desperate to see him.
The reason behind the spread of these bacterial diseases is the complete destruction of the sanitation system. You have groundwater mixing with the sewage, there's the severe overpopulation, the extreme heat, and a lack of ventilation.
Gaza is facing a public health emergency. For the first time in a quarter of a century, a polio epidemic has been declared. The virus was detected in samples of sewage and wastewater flowing between tents. Israeli attacks have killed more than 16,250 children in nearly 10 months of war. For those who survived the Israeli bullets and bombs, a combination of famine, disease, and displacement compounds their misery. Michael Appel, Al Jazeera.
Well, Mukesh Kapila was the emergencies doctor for the World Health Organizaton, as well as a medical doctor. He's now Professor Emeritus of Global Health and Humanitarian Affairs at the University of Manchester and joins us live from Geneva. A very warm welcome to you. So what does the fact that these somewhat preventable skin conditions are occurring, what does that say to you about how dire conditions are in Gaza?
Well, I think we shouldn't be surprised that we're getting outbreaks of communicable diseases. Polio virus has been detected. We now have hepatitis recently reported, and there have been epidemics of, for example, respiratory infections and skin infections. And these are a combination of what your correspondent was saying: a lack of hygiene, water, sanitation, and breakdown of public health services. Now, if you go by the experience of other wars and conflicts like Syria or Afghanistan or Yemen, for every person who dies or is injured by a bullet or a bomb, you can say that about 3 times that number will get sick or indeed die from preventable communicable diseases. And all these factors are coming together now as a logical legacy of the past several months of the conflict that has been going on, without any supplies, without any replenishment, without any attention to the minimum requirements for human survival that are essential in those circumstances.
As you say there, these are highly communicable illnesses. I mean, presumably these diseases can also spread across borders to Israeli troops and indeed Israeli citizens.
Oh, indeed. We know, and actually we know this from our global experience of COVID. You can close borders as much as you like, but it doesn't stop the spread of disease. I know that the Gaza border is quite tightly controlled, but honestly, I mean, in fact, this polio virus strain is connected to the polio virus that has been detected. The variant is connected to strains in Egypt. And I think the whole of that region of the Middle East is at risk and beyond. And it's extremely important that we take a regional approach to these public health crises, as we know from other situations. But, to looking at the patterns of the conditions that have emerged, The number one, we can't do everything at once. And of course, we've got many, many months of damage. So I think the top priority is obviously water. And, human being needs a minimum of 3 liters of clean water to drink each day, and maybe another 6 or 7 liters of water for normal hygiene purposes. So are we getting 10 liters of water per person for the 2 million people in Gaza? I very much doubt it, especially when all water supplies and sanitation services are disrupted. So that, I think, is the immediate thing that can be done. Water is like medicine, really, in cases like this. And then, of course, we have the immunizations that WHO has been organizing, trying to send in polio vaccines.
Talking specifically about immunizations, of course, disease appears to be something at least the Israeli army has prepared for. We know that there are reports of them vaccinating their troops, but that level of care clearly is not available to Palestinians who need it most.
Indeed, I think the Gaza population has been displaced so many times. So they've been moving from place to place to place to place. So logistically, for anyone to do any proper organized vaccination campaign, keeping records and so on, is highly problematic. And I think what the Israeli soldiers could themselves do is they could pause the fighting, and everyone could join hands with the international organizations like WHO, UNRWA, and so on, to try and make sure that every child is covered, so that at least it's highly preventable potential epidemic can be stopped in its tracks. So, and the same thing applies to other conditions as well. I mean, cholera could also break out. We have had dysenteries already reported, and we might have bacterial dysenteries as well. So those kinds of conditions require, I think, a public health approach, which would then affect a number of communicable disease risks. So it's not about addressing one disease at a time. It's not polio yesterday and hepatitis today and something else tomorrow. It's trying to take a public health approach to create the conditions to address all these risk factors, which are now very prevalent in Gaza.
Speaking as the former emergencies director at the World Health Organizaton, let me ask you this. What rules govern what an occupying force or a force involved in a conflict needs to do? What duty of care should they provide to a civilian population? And are we seeing that on the ground in Gaza?
Well, I think the international law is very clear that the occupying power has a responsibility to look after the health and the welfare of any people under its control. And that obviously means providing basic healthcare services and basic survival needs like food and water and sanitation. That much, I think, everybody is well established. Unfortunately, the vicious nature of the war that has been fought in Gaza with no holds barred, and the transgressions of humanitarian law that have accompanied the conflict over past many months mean that actually this has obviously not been happening. And to add to that, the restrictions and obstructions of humanitarian aid mean that aid agencies cannot mitigate the consequences of the conflict. So there are two things that need to happen here. One, I think we need to, those who are fighting need to take care about their civilians to minimize damage to them. And the second thing is, obviously, aid that can help to mitigate the consequences of war, has to be provided. And neither of those conditions have prevailed in Gaza in past months.
All right. Mukesh Kapila, it's been extremely helpful to hear your thoughts and expert views on all of this. Many thanks for joining us.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.